Hey everyone, welcome back to the channel where we dive into the mind-blowing world of science and health. Today, we're unraveling the mystery of anesthesia, the magical yet slightly terrifying process that keeps you out cold during surgery. Ever wondered what's really happening in your brain when you're under anesthesia? Let's get into it. First, anesthesia isn't a single drug, it's actually a combination of drugs designed to knock you out, block pain, and immobilize you. It's like hitting the pause button on your entire nervous system. The drugs work fast. Once injected or inhaled, they enter your bloodstream, reach your brain, and within seconds, lights out. Doctors tailor the dosage based on your weight, age, and health. They're like highly skilled technicians balancing a complex machine. Too much anesthesia can cause dangerous complications, while too little might result in the stuff of nightmares, waking up mid-surgery. But don't worry, modern monitoring equipment drastically reduces these risks. Anesthesia isn't the same as sleep. While you're asleep, your brain cycles through different stages of activity. Under anesthesia, however, key regions of your brain, those controlling consciousness, memory, and movement, are practically in shutdown mode. It's as if your brain enters a deep, suspended state. Doctors monitor your vitals like hawks: oxygen levels, blood pressure, heart rate, and even brain waves. Everything is meticulously controlled to keep you stable and safe. The moment you lose consciousness, your brain temporarily stops processing sensations like pain and awareness. Now, let's get into a fascinating real-life case. A patient named Sarah went in for a routine surgery to have her gallbladder removed. During the procedure, she was completely unconscious under general anesthesia. However, when Sarah woke up, she recalled having a vivid dream in which she was on a boat surrounded by dolphins, all speaking in strange, rhythmic patterns. What made this story particularly eerie was that she later learned the surgical team had been discussing a vacation in the Florida Keys, an area famous for dolphins, while she was under. Researchers have found that, in rare cases, patients can pick up on external sounds or conversations even when deeply anesthetized. These sounds can sometimes be woven into dream-like experiences. Fortunately for Sarah, she felt no pain or distress during the operation, but the surreal memory stuck with her for years. Anesthesia is generally safe, but as with any medical procedure, there are risks. Complications are rare but can include allergic reactions, breathing difficulties, or cognitive fog, especially in older patients. Some people experience postoperative cognitive dysfunction, a temporary decline in mental clarity that can last days or weeks after surgery. The recovery process varies. Most people feel groggy but return to normal within a few hours. However, you might also experience some short-term confusion or bizarre thoughts as your brain reboots. This explains why people sometimes wake up saying hilarious or bizarre things, like confessing their love to the nurse or believing they're in a completely different era. When anesthesia wears off, your brain doesn't just snap back to full consciousness. It's a gradual process, almost like rebooting a computer. Some people wake up with vivid dreams, disorientation, or euphoria. Others might experience anesthesia hangover, drowsiness, dizziness, or headaches. This is because your brain is adjusting as the drugs slowly leave your system. For some patients, the moments right after waking up can feel dreamlike, with fragmented memories of what they thought were surreal events. Doctors and nurses are trained to help guide you through this disorienting phase, ensuring you're safe and comfortable. There are multiple types of anesthesia. General anesthesia is used for major surgeries when full unconsciousness is required. Regional anesthesia, like an epidural, numbs an entire region of the body, while local anesthesia numbs just a small area, perfect for dental work or minor stitches. Each type serves a different purpose, depending on the procedure and patient needs. One of the biggest questions in neuroscience is how anesthesia affects consciousness itself. What exactly is consciousness, and how does a drug switch it off so effectively? Researchers are still seeking answers, using anesthesia as a tool to study the brain's most elusive function. By observing how the brain transitions in and out of anesthesia, scientists hope to uncover more about the nature of awareness and perception. So, the next time someone says anesthesia is just like falling asleep, you'll know that's not quite true. It's a complex, carefully controlled shutdown of key brain functions that enables life-saving surgeries and pain-free medical care. Anesthesia truly is a marvel of modern medicine. Have you ever had a strange or funny experience with anesthesia? Share your story in the comments. And if you found this video enlightening, give it a thumbs up, hit that subscribe button, and ring the bell so you never miss a new deep dive into the wonders of the human body. Thanks for watching.